restriction is frequently recommended in heart failure guidelines, but the optimal restriction range from less than 1.5 gram to less than 3 gram daily, and its effects on patients with heart failure with preserved ejection fraction isn't clear, as they have often been excluded from relevant studies. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to discuss about what happens if salt intake is overly restricted. Restricting salt intake is considered a key component of heart failure treatment, but restricting it too much may actually worsen the outcomes for people with a common form of the condition, suggests research published online in the journal Heart. Younger people and those of Black and other ethnicities seem to be most at risk, the findings indicate. A phase 3 randomized double-blind placebo-controlled study, this trial was designed to find out if the drug spironolactone could effectively treat symptomatic heart failure with preserved ejection fraction. Participants were asked how much salt they routinely added to the cooking of staples such as rice, pasta and potato soup, meat and vegetables, and this was scored as 0 points, that is none, 1 that is 1/8 teaspoon, 2 1/4 teaspoon, and 3 half plus teaspoon. Around half of the participants, that is 816, had a cooking salt score of 0. More than half of them were men, 56%, and most were of white ethnicity, that is 81%. They weighed significantly more and had a lower diastolic blood pressure, that is 70 mmHg, than those with a cooking salt score above 0, that is 897 of them. They had also been admitted to hospital more often for heart failure, were more likely to have type 2 diabetes, poorer kidney function, to be taking meds to control their heart failure, and to have a reduced left ventricular ejection fraction or lower cardiac output. Patients with a cooking salt score above 0 were at significantly lower risk of the primary endpoint than those whose score was 0, mainly driven by the fact that they were less likely to be admitted to hospital for heart failure. But they were no less likely to die from any cause or from cardiovascular disease than those whose cooking salt score was 0. Those aged 70 or younger were significantly more likely to benefit from adding salt to their cooking than were those older than 70 in terms of the primary endpoint and admission to hospital for heart failure. Their study findings show that the volume of plasma in the blood, an indicator of congestion, wasn't significantly associated with cooking salt score, suggesting that low sodium intake didn't ease fluid retention in people with heart failure with preserved ejection fraction, point out the researchers. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.